I'm Dr. Carrie Lowery at Beyond Smiles of Park Ridge. You have received this video because you had contacted my office to set up for an airway evaluation. Possibly another healthcare provider that I work with had suggested that you see my office. Maybe a team member at my office had recommended that we do an airway evaluation. Or maybe you yourself had done some research and came to find my office and felt like an evaluation would be the great next step for you. Airway and breathing related problems can develop very differently in different patients depending on what the root cause is and the body's ability to compensate. They can present like simple snoring. It can present like mouth breathing, chronic fatigue, sleep apnea, upper airway resistance. There's a variety of different issues that need to be dealt with in order to treat. We break up our evaluation into 3 parts. This is also how I treat all of my patients. So structure, function, and behavior are the 3 components that we look at during our assessment. Starting with structure. To look at structure, first we take a CBCT image, which is a 3-dimensional X-ray. In this image, we are able to see a variety of different things. We're able to see the growth of the patient. We are able to take measurements to see where that growth parameters has happened properly or where those growth parameters have kind of not fallen in line with where that child is or adult based on their age. These images are read by myself and also by a radiology team, and a radiology report is enclosed in part of our evaluation. The other thing that we can evaluate on our assessment is soft tissue. So the 3D CBCT can evaluate for a child to show me if there are enlarged adenoids, if there's tonsils that are enlarged as well, if the patient has a tongue restriction. I also take the measurements to see where the growth has happened. Lastly, part of the radiology also allows me to measure what the airway is. I like to be able to see, does the child or the adult have a very small airway? Do they have a very large airway? It enables me to know if that sleep and breathing problem is coming because of size or because of soft tissue. The second part of our structural component of our evaluation is we take what's called an iTero scan. It is a digital scanner that we use in the patient's mouth to actually image what their dentition looks like. So this will enable us to be able to see if there is a crossbite like you see in this patient, or if all the teeth are very crowded, if there's a lot of spacing. This scanner is also what we use to help develop our treatment plans. The second part of our assessment is function. So think of how the soft tissue in your body reacts with the structure. So we're actually testing your ability to breathe and your body's ability to function through the processes of breathing. So first we start with some photos. So what we look at in these are, we're looking at how does the patient hold their body? What certain, compensations do they do during the day that they don't even realize because their body is developed in such a way to be able to breathe better and therefore sleep better. A lot of times these photos are shared with other providers that we work with, body workers, chiropractors as such, to help treat the whole patient. Second part of our function test is our nasal breathing test, where we actually test the ability of you to be able to breathe through your nose. So this is a newer technology that we've introduced called our 4-phase rhinometry testing. It involves just placing a small plug in one of the nostrils and placing a mask over the mouth and just taking 4 simple breaths. We then do a decongestant and retest to see if there is a soft tissue component or an inflammatory component that could be causing issues for you to be able to breathe through your nose. That also helps us develop a treatment plan for our patient to figure out if inflammation is a large part of the component which is causing the mouth breathing, the snoring, the sleep apnea. The third part of our testing is actually done by our myofunctional therapist. If you were referred to us by a myofunctional therapist, then we would be working with the report and that myofunctional therapist, what recommendations they have made. If you are working with our myofunctional therapist in-house, then she would be doing that testing, coming up with an evaluation of, what is your or your child's ability to function with your tongue properly? Are they able to lift their tongue? What is the strength and tone of their tongue? How is that tongue functioning in both speech, sleeping, breathing, eating, and all of the body processes that we do all the time? Our third component is our behavior component. Behavior is essentially where the structure and the function meet. So the bony structure and the soft tissue components and the tongue components and the overall body components meet in behavior. Behaviors are something that, we see during the day, but we are testing what is the behavior at night while you're sleeping. We use a HRPO, which stands for High Resolution Pulse Oximeter. From this oximeter, we're able to see a variety of different things that happen when you sleep. We look to see, what is your heart doing? Is your heart rate changing erratically? Is your heart rate elevated or too low? We also check to see, are you getting enough oxygen? Are you desatting? Are you losing oxygen during the night? Is that loss in oxygen happening a variety of different times or just a few times? Loss in oxygen during the night is very concerning to adults, especially children. If you're losing oxygen and your pulse is erratic and elevated, then obviously you're not going through the proper sleeping cycles to actually get restorative sleep. All of these components with the other structural and functional components are put together as the evaluation. If you came to us because you had seen a sleep doctor, we still like to do this HRPO just to get a baseline of what you are coming in with so that we can figure out if our treatments are actually making progress to help you. As you can see, we intake a lot of data. Going through the structure, function, and behavior, all of the components that I showed you here, there's a lot of information. Once we get all of that information together, we will set up an appointment approximately 3 weeks later for either you to come into the office yourself or do it via Zoom. During that appointment, we will go over all of the data. We will also go over the diagnosis. We will go over the other healthcare professionals that we will suggest working with, and go over what treatment I'm recommending that we do here. At that point, then my treatment coordinator will also discuss with you billing options, and we'll let you know, what your next steps would be. Thank you for taking the time to listen to this video. If you have seen outside providers, please bring that data with you. Whether it's an ENT or an SLP, the more information that you have or things you've had done are very helpful for us. We really look forward to meeting you on the day of your assessment. Please don't hesitate to call with any questions.